Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a fantastic episode ahead of us today. We are going to be chatting about massive weight loss, circumferential body lift. We're going to be talking about the drugs like Mounjaro, Ozempic, Wegovy, which are the hottest craze. And all that's going to be through the beautiful Katie, who has honored us and with her presence. Katie is a patient of mine, and we're so grateful. And always, any patient who comes on our show, I always use the word courage, because nobody wants to come on a show of any sort and discuss their personal life. But we're grateful because I think the patients who come on our show appreciate the value that it brings to the patients or the individuals who are in that journey behind them. Because about a year ago, you were there. Mm-hmm. And someone like yourself may have made a difference in your life, and it's wonderful that you're paying it forward. So welcome to the show.
Thanks for having me. Happy to be here.
So we're going to chat about the A to Z to obesity. And we're going to end, the finish line is in this beautiful woman that you are, and this gorgeous outfit that you have on, and the happiness that you have, but it didn't always start out that way. And so let's back up here and start with some of the basics. So you're 40, right?
I am.
You have two beautiful children,
yes.
Right? And you were telling me that you have always struggled with weight loss, which
yes.
actually happens to be the case with most people. So there are two types of individuals who deal with weight loss, or obesity for that matter. Those who are truly obese and those that struggle with some weight here and there. Mm-hmm. The reason why I think it's important to categorize them is just like someone's predisposed to diabetes, someone's predisposed to Alzheimer's. I had glasses at the age of 16. There are things that we are predisposed genetically to. And I think as we are advancing in the sciences of obesity, we realize that certain individuals have a predisposition, a biology. They have a greater time and a more difficult challenge of losing weight. And, societal wise, we kind of just say they're lazy. Just stop eating. What do you mean? And we both know, and you'll explain to us, that obviously it's not that simple. And there are individuals who are overweight because they eat shitty and they don't exercise and whatnot. But then again, there are individuals who are overweight. They eat 1,200 calories a day. Mm-hmm. They work out 7 days a week. And because of their metabolism, because of their genetics, because of the way fat is distributed through their body, they are resistant and recalcitrant and stuck. And so let's start with your weight loss challenges. When did you were telling me you've been having issues since you were a young adult. So when did you start to become obese? At what point in your life?
Maybe around 8. I mean, I think it's since childhood. I was always overweight. So it was just kind of a lifelong thing. And I would try to lose weight and like yo-yo diet and be successful sometimes and not others, lose significant amounts of weight, but always gain it back.
Were your parents overweight?
They were.
Right.
Yes.
So when I have interviewed, I had 3 sisters on my show, beautiful sisters.
I listened to that episode.
Right. And it's a very common theme.
Yes.
Not uncommon, and actually very common, that obese children have obese parents. And we can get into that in another day. So here you are, I can only imagine 8-year-old. As it is, the perfect 8-year-old is insecure and being bullied and all that horrible stuff. And here you are, 8 years old, struggling with weight. And that carries on with you, obviously, to your young adulthood, into college, and so on and so forth. And so here you are, and you told me, what was the max weight you ever got in your entire life?
After I had my second child, I was at 300 pounds.
Okay, so no question that childbirth, just in general, the average person makes you gain weight. And many people with each incrementally pregnancy gain and then don't lose a certain amount of weight. So it's very common. I see hundreds of women a month. I weighed 120 when I was in college. I had my first child. I got to 135, 140. I had my second child. I'm on 165, 170. I just can't lose it. So it's very common, let alone if you have a predisposition towards obesity.
Sure.
So here you hit 300 pounds, which is unfathomable to me because I'm looking at you in the way you look now, and you just showed me a photo of yours, which, with your permission, we may take a look at, that is unrecognizable. And here you are at 300 pounds. So you have this beautiful child. You're married, yes?
I am.
And what happens? What's that moment? Because at the end of the day, You're not 100, 300 pounds now. So there was a moment that you turned and went another direction. What do you remember what that moment was? Was there an event?
It's hard to kind of pinpoint a moment because it is kind of like a lifelong thing of trying to lose weight and trying to be fit and trying to be healthy. And I think it was always really hard because I didn't actually ever feel like I ate more than my friends or other members of my family. So it was always interesting that I was much more overweight when I didn't feel like my lifestyle was much different. And
What were you doing? So let's start with that, because I think people have a predisposition, an inaccurate one, to label all people that are overweight as eating Kentucky Fried Chicken and having soda pop, right? That's sort of this vision that you have at TLC, right? But here you are, not the case. You were eating well. So tell me what you were doing when you were struggling. Like, what were you managing on the diet and exercise front?
I think I was just being normal, honestly. I think I was just cooking and eating out, and I am a foodie. I love food. Growing up, my whole family, I think so many of our memories surround the dinner table, and so it was kind of like a culture of food. But I think maybe perhaps that. But I didn't feel like
Were you eating a ton of food?
No.
Were you eating like everything?
I wasn't going to fast food all the time.
Was everything tempura and buried in butter? Okay, so then you were eating like everybody else, except you're eating your 1,500 calories and you're keeping 1,400 of them, whereas for whatever reasons, somebody else is eating 1,500 calories and they're burning 800 of them. So so you told me that the first wave from 300 to, what do you weigh today?
150.
So here you are, half the woman you used to be. And what started that journey, this final time, because you said you've done it multiple times, this last journey and the final journey, let's call it, you got down almost 80 pounds from the true diet and exercise standpoint, right? So that, I imagine, means you ratcheted up your exercises.
I was just really careful with my diet and trying to eat whole foods, healthy, prioritize protein, and just try to do everything we all know to do. And I hired a personal trainer. I bought a Peloton. I did everything that I could and was really strict. And I got down to, I forget what it was, but I lost about 80 pounds doing it that way. And then just plateaued for a really long time. Like, the scale didn't move for over 6 months. And at that point, I went to my doctor and I just said, I don't know what else I can do. Like, is this just where I'm at? Is this just it? And no more can happen. And he said, let's try this new class of weight loss drugs as a way to manage and help you lose weight. And so I did.
Okay, awesome. So that's, people come to me all the time. They want to have surgery. And my goal is for them to look amazing.
Yes.
In order for them to look amazing, they have to be great candidates, not good candidates. For you to be a great candidate, not a good candidate, you need to be sufficiently deflated, lost enough weight so that when we do the surgery, holy crap, you look great. And so often I'm telling patients, I don't care how you lose the weight. I need you to lose the weight. And so what we're going to talk about is this whole new world that's like the craze right now, which is this world or new class of drugs. I mistakenly called them all semaglutide. You corrected me, which I appreciate, because it's new and I'm learning. I don't prescribe them.
I mean, I'm not a doctor either, so this is just my layman's knowledge of it.
Your layman's not. You're pretty savvy, Gail. But we call them these new weight loss drugs. I know them by their names. We have Ozempic, we have Wegovy, we have Mounjaro, and I assure you in the next year we'll have 500 new ones. You took Mounjaro, right?
I did.
And tell me what happened. Okay, so here you are. You're doing diet and exercise. I mean, you're vigorous. You're trying your very best. You lost a ton of weight. Awesome. And it's just not moving. So do you, just live like this, or do you reach out and take advantage of new drugs? So I think that I personally am a huge advocate, especially if you are a 220. How tall are you?
5'8".
So you're a tall woman, but at 220, you're still overweight. I'm all for it, right? I'm all for it because that's what it's intended for. Because while we don't know the aftermath of these drugs yet, right? We just don't know, just like we didn't know that penicillin would be good, but radiation would be bad. Like, we just don't know. But there's so many people taking advantage of it. And when you are overweight and not just trying to lose 15 pounds, the benefits, the upside of decreased blood pressure, decreased sugars, there's 100 things that improve when you lose weight, is so much greater than the small potential that may or may not exist with this. So go ahead and tell me, you took the drug.
I did. And I think one thing that's important to mention is before I took the drug, when I tried to diet, it was really hard. I think a lot harder than maybe for some people, because I would get massive headaches, almost like I was dying of starvation headache, like really bad headaches whenever I tried to reduce my caloric intake or try anything like intermittent fasting or anything.
Sure.
And so it was just really hard for me mentally and physically when I tried to do that. I started taking Mounjaro, which at the time I took off-label as it was FDA approved for type 2 diabetes at the time.
Right.
Recently, it's now FDA approved for weight loss under a new name called Zepbound, which is the same thing as Mounjaro, but one is for type 2 diabetes now and one is for weight management, similar to Wegovy and Ozempic. They're actually the same thing, but Ozempic is for type 2 and Wegovy
this is what I love about the show, and I love about my patient population. Very bright people. See, here I am. I'm in this milieu right now and I don't know enough about it. And it's great to be educated about that, because that's very important to understand the nuance of these medications. Okay, gotcha.
So I started taking it and it was almost like a flip switched, and I no longer had that raging hunger, and I no longer had what a lot of people call food noise. And I don't think if you've struggled with obesity, you probably don't know what that is, but food noise is just kind of like this obsessive, intrusive thoughts about food all the time, where you're at breakfast, but you're thinking, what am I going to have for lunch?
Right.
What are we going to have for dinner? And you kind of almost plan your life around these food events, and it's just intrusive thoughts all the time about what else is there.
It's interesting. It sounds like other individuals who are addicted, right? They're addicted to smoking, or addicted to gambling, or addicted. So everyone in those addicts will tell you that the thoughts are intrusive, and they ruin their flow of their normal way of being.
Sure.
Right?
And what's interesting that you mentioned that is they're starting to find through research and studies that whatever, and we can talk a little bit more about the makeup of these drugs, but they actually are helping people with other addictions.
Yeah, I can imagine
people
that.
are, they're not gambling. For me, I was never, I never drank that much, but I really don't have as much desire for it at all, much to my husband's disappointment.
Yeah.
He's a big wine collector, but things just don't have the same appeal that they used to. A girlfriend of mine, she was admittedly addicted to sweets, and she's like, I just don't have
that
any
urge,
desire.
that craving.
Yes, the cravings.
Yeah,
the cravings are gone.
And I think that's an interesting concept, because we will eventually, as the dust settles, figure out how they work. Like all drugs, they work often in many people, but work better in a certain subclass.
Yes.
And they will eventually delineate that, because now the masses are using it. You'll realize that it's really great in such category, works highly efficiently, not as well in this category. And the same thing with smoking cessation, right? Smoking cessation, same thing. You take certain drugs, some people it just like, boom, automatically they stop smoking. Some people, doesn't work as well for them. So it cut out the craving or the edge or that hunger or that intrusive conversation. And then it sounds like you were able to just knock off another 70 or 80 pounds.
I was. It allowed me to stick within a caloric amount that was healthy for my body. I did about a 500 calorie deficit. I didn't want to lose weight too quickly. I wanted to lose it over the course of a year, which I did. And I did it in, 1 to 2 pounds a week in a healthy way. Because I want to keep it off, but it worked really well. I was able to do that. I wasn't overly hungry. I think Mounjaro works by, I think it triggers, and here's where I'm going to get into the medical speak, because I'm not a doctor and I don't know.
But it's okay.
But it affects 2 different hormones that you have, and it helps delay gastric emptying, helps you feel fuller quicker, stay fuller longer. And it is a terzepatide, which means it's a dual agonist. So it affects 2 hormones, whereas Wegovy and Ozempic are 1 hormone. And it regulates blood sugar and insulin.
And so these drugs, and I think that once I guess the problem with them is they just got a bad rap. They don't have a bad rap. Everyone loves them, but they're getting a bad rap because people want to be hush-hush about it, because it's like cheating. And there's just a lot of extra stuff about it that the dust has to settle on.
Yeah.
But the reality is that they're great drugs, as we know them so far, and they're indicated and that they're perfect for someone like yourself.
Well, isn't that sad that you call it cheating? Because I don't think that, someone would say that someone who needed an antidepressant or blood pressure medication was cheating to get to the place where they're healthy, right? So I think there's this like fat phobia, or this pervasive thought that the community has, that the public has, that makes weight loss such a hush-hush, like secret thing, which it really shouldn't be. It's your health. Like everyone deserves to be healthy.
No, I totally agree with you. I think where you're going to run in this gray zone is, and frankly, it doesn't matter. And that's why I say it very frank. I don't care how you lose the weight, because I think that the fact that you lose the weight and the weight loss itself and all the benefits of that weight loss almost trump, and I don't mean if you're snorting cocaine, almost trump the method,
Sure.
right? And I'm huge pro advocate of people losing weight for the sake of being healthy,
Sure.
and being high energy and low blood pressure and lower sugars and all that. The reason why it's become a little sort of, there's up for debate, is when you have ADD and you take amphetamines, it's a treatment. It treats you. But when you just want to stay up late to just study for a test and you're using the amphetamines, you're cheating conceptually. And that's sort of where this drug is going to have some play a little bit. It's like, hey, I could lose the weight if I just maybe didn't eat all those muffins, or maybe I didn't eat out. And I don't want to do that because I don't have the willpower, the energy. Why not? I just take a drug, right? That's the concept. And I'm going to lose 15 pounds versus I have a medical condition. I'm doing everything under the sun. I eat well, I diet, I have a chef, I train, and I'm just not getting there. Aside from the fact that I don't like the way I look, I'm still hypertensive. So I think if I told you scenario B, there would be no discussion. Nobody would even dare shame that person. If I say scenario A, it wouldn't be that they shame them, but that's where that sort of, are you cheating? It doesn't really matter because I don't give a shit. And moreover, all I care about is that you were able to get to a place where you were at a great weight that you could sustain. And it's clear by just having a conversation with you, you did everything under the sun anyways.
I did my best, certainly.
Okay, so here you are, boom, you dropped the weight, diet, exercise, the benefits of this medication, and you are now at 150, which is amazing. You're 5'8", 150, phenomenal. You feel good, everything.
Yes.
You go in front of the mirror, and this is one of those weight loss journey conversations that everyone has, and I've lost 150 pounds. So while when I wear clothes, the benefit is medically I feel great. Visually, when I wear clothes, I look much better, right? I was 300 pounds, now I weigh 150 pounds. But internally, under all that clothes, when I'm naked, most patients don't get the benefits that they had maybe thought once they had lost all the weight, because now they have all this extra skin. How did you feel, aside from the medical energy level, and when you looked at yourself and you had lost 150 pounds? Tell me about the way you perceived yourself from a cosmetic standpoint.
Well, I think that especially my stomach, and I don't know if we mentioned already, I had a hernia too, but it was just kind of like this apron just of skin. And so I think what was hardest for me is like when I would wear pants, like I could never tuck my shirt in because it kind of felt like a front butt, if you will.
Right.
So it wasn't like an attractive look.
Got it.
And I definitely wanted to get that taken care of.
Right. So I think for some patients, they're prepared for it mentally, financially. They anticipate it. They know it's going to happen. And I have patients who lose the weight. And when they get there, they're shocked. They're kind of almost like, what is this? This is another goddamn problem.
Well, it's kind of like the sad thing about weight loss, right? Is it comes from all the places you don't want it to come from.
Yeah.
You're like, I wish it could be put back in certain places.
And so what happens is they present somewhat a little bit disillusioned. Because on the one end, you would have anticipated, God, if I lost 100 pounds, I'd be great. Not really necessarily in their minds expecting that there's still yet another whole phase. So I think it's really important to recognize that it's almost impossible to lose 70, 80, 90 pounds. Anyone. Doesn't matter if you're 20, 30, 40. It doesn't matter if it's gastric bypass or seriously just starvation or you did triathlons. Once you lose the weight, your body's going to have some sequelae. In your instance, the area that bothered you the most obviously was your abdomen, but it was more than your abdomen. So you had one thing that was specific to you, one thing that's always common. The thing that's always common is people at that weight don't just have a front problem. They have a side problem and a back problem. Having 2 children is a front problem.
Yes. They're worth it, but yes.
2 children plus losing 150 pounds, you lose it circumferentially.
Yes.
And the reason why that's important is because the treatment for it is not your garden variety tummy tuck. It's tummy tuck on steroids. It's a circumferential, all the way around, body lift, circumferential lipectomy, belt lipectomy. These are all terms that describe the same thing, which is essentially, I now have redundancy, excess, all the way around my body. And instead of just a front surgery, tummy tuck, I need a 360 surgery. We call that for lack of better words, the easiest word is a body lift.
Yes.
And the reason it's called a body lift is because you get a tummy tuck, check, and then your thighs get lifted, check, and your buttock gets lifted, check, hence the term body lift, lifting. In addition to that, you had another curveball, which is you had an umbilical hernia, but not your garden variety umbilical hernia. So it is very common after having multiple pregnancies that you develop a little bulge in your belly button. It's this little outie. Your belly button can sometimes become an outie and never go back in. That is a umbilical hernia. Very common and usually inconsequential. In your instance, you had a significant hernia. I would say the size of almost a tennis ball, from a golf ball to a tennis ball, correct? That was coming out of your belly button, which added a whole new dimension to it. Because what the hell do I do with that? Do I call a general surgeon?
Yes.
Do I need mesh? Do I need to fix that first? Do I need to have a plastic surgeon and a general surgeon there present? How do I go managing this? Tell me what you read or understood as you were going through this process, because that hernia didn't come about as a weight loss. You've had it since your second pregnancy.
I did. And at that time, my OB, who's wonderful, said, you will have to get this surgically fixed. But she advised me to wait until I knew that I was done having children. And she said, if it's not hurting you, then wait till your kids don't need to be picked up anymore, because you won't be able to lift for a while after this type of surgery. So when I was ready to get these surgeries done, I did a lot of research online and found you, and you do both of them and really specialize in both of these things, which was actually highly unusual. And it made me feel better knowing that you do a lot of umbilical hernia repairs, because I didn't want to go to a general surgeon and I didn't want to have mesh, because really that just, in my view, kind of just covered it up, but it didn't actually fix the problem of stitching your abdominal muscles and wall back together, which is what you do. So the fact that I could go to one person and have that person be an expert in both of the procedures that I was looking to get was a real appeal. Yeah, and I told you I only came to you.
Yeah, and I'm honored that you came only to us. I know
you told me to keep looking around.
Yeah, we always tell you, because it is my obligation to make sure that you
and I appreciate
are informed and go out there. When it comes to abdominal walls and abdominal wall reconstruction and hernias, it is an area that I subspecialize in that I feel like anything I do, I specialize in. Otherwise, I wouldn't do it. But this just happens to be an area that I do a lot more of than most people, and much severer cases. So the gist of it is that a hernia is I have a hole in the middle of my belly. There's literally a hole in my abdominal wall from which the contents of my insides are protruding. That's different than a diastasis, which is just some muscle separation. You still have a thin film and nothing is coming through. You have a bulge, but it's not an actual breakthrough. The reason why that's important is that hernias almost always need some kind of correction of that hole.
Yes.
And a traditional, very standard approach is that a general surgeon usually will go and will create a patch effect, cover that hole like if you were patching a hole in a wall.
Yes.
The materials they use are often inflammatory, and it's not ideal. Now, when you have hernias elsewhere in your body, that might be the ultimate necessary treatment. But in this instance, what's happened is that your muscles pulled apart, check. There's this tiny little shitty thin film between them that's barely holding anything on, check. And a hernia starts to power its way through this really wispy, thin film. It's not coming out of your abdominal wall, but rather this sort of area that isn't really supported. Therefore, the treatment is not only can it be done this way, but needs to be done this way, is that you need to push the hernia back in, and then you need to close and bring the muscles together. And in essence, the mesh, the patch, the repair is the muscles 2 layers over, and there's no way in a million years that thing's coming out, because that's the normal abdominal wall. And it's critical to do them together because that's the right answer. Often I see patients who are like, yeah, last year I had my umbilical hernia repaired with mesh. I'm here to do my tummy tuck. Oh my God, kills me. 1, you just wasted a whole surgery. 2, now I have all this shit in there that I need to fix. It doesn't need to be done that way. A hernia in your groin, that's a whole different animal. That doesn't have anything to do with your pregnancies, in that muscle was separated. So good on you. and your hernia was absolutely one that was legit and quite large. You said, you're the man, Dr. Rahban. You're going to fix my hernia. You're going to fix my excess skin. So we're going to go ahead and do a circumferential body lift in addition to your mesh repair. So one of the things that I think is important, and you highlighted it on, is that here in Beverly Hills, there aren't that many people that are doing body lifts. I don't know. I don't really go outside of my own office to know that. But there's a reason for that, because a body lift requires it's a significantly larger surgery. So a tummy tuck, you're laying on your back, and we do the front. It's one of the top 5 surgeries that any plastic surgeon would do.
Sure.
A body lift, I got to turn you around like a rotisserie chicken, right? You're literally turning the person, and you either return them once or in the way my technique, twice. In other words, I turn you on your side, and then I turn you on your side again to get around. And the markings are very complicated because you have all this redundant skin, and you're trying to mark the patient as if all that skin gone, and then create a scar in a place that's hidden that you can then wear underwear. Like, there's a lot of moving parts to it. Because of my personality and the way I like things done, I see all body
He means perfectionism.
Well, yes. Or some people call it anal or difficult. Or anyways, we'll digress. So I like to see the patients the night before because marking you took how much time?
A lot, like an hour.
Like an hour at least.
At least, yeah.
Why? Because I had to pull and turn and try again and Sharpie. You need to be standing. The reason is, if I did your markings the morning of, the likelihood is I'd be in a rush. And the likelihood, I'd say, it's good enough.
And it's already a long surgery as
Right.
it is.
And so I like to see you the night before because I like to take our time in together and really position you and mark. And our goal is to create a nice outcome and try to have your incision, your scar, end up in the place of a underwear or a garment or whatnot. So you come the next day. How long was your surgery?
Well, you tell me. I was out.
Yeah, it was about
It seemed long.
Yeah, it was about 6 hours.
6 hours, that's long.
Right? Many patients who get massive weight loss surgery tag team it. So this is very important for all you listening. If you lose 100 pounds, I guarantee you your abdomen or your trunk will not be the only thing that bothers you. Your breasts will bother you, your arms will bother you, your inner thighs may bother you, your neck may bother you, your upper back may bother you, and it is super common for you to go somewhere where they do a bunch of things all at once. Well, that sounds great. I go to sleep, I wake up, my arms, my legs, and my abdomen's done. Yeah, but at what cost? And that cost is there's no way a surgeon is going to repair your arms, repair your legs, and repair your abdomen, him or herself. It's NASCAR. You'll be laying there and a bunch of people will be operating on you.
Sure.
If that's your preference, I'd rather have shittier work done, but get more of it done in one setting, knock yourself out. I like Hermes. I like things well done. So I am the only one that operates on you, which is incredibly unusual for anyone that does body contouring because it's a lot of sewing. It's not an eyelid, it's not a facelift, it's not a nose job. It's a shit ton of sewing. And so almost every person who does body contouring has a nurse practitioner, a PA, another surgeon. They're just sewing away.
Which is what kind of boggles my mind, because for the patient experience, actually that part is the thing we're going to live with.
100%.
Is that scar. So,
but remember, they're not transparent about it. They don't want to lose you. What are the chances that you may come back to do another surgery? Patients don't want the two recoveries or the 3 recoveries, and it's sold to them as this is a win-win.
sure.
So again, no problem. Do it that way. I prefer 6 hours. Myself, I'm it. And I focus in and I do as great a job as I physically can. And not uncommonly, you'll come back at another time and we come to fight again and we take care of the next thing. So in your instance, I focused the 6 hours on your circumferential body lift. We did your surgery. Yes, your hernia was quite a large hernia. We fixed all that. And then you go on to recover. So the number one expectation is tummy tuck. Holy shit, that's going to hurt. Body lift must have been through the roof. It must have been unbearable. Were you hospitalized for a week? Because the concept is that because it's technically twice, the front and back, it must have been twice as bad.
I mean, I've never had the one, so I can't really compare the two, right? But I think that it was hard. It's a big surgery.
Sure.
So the recovery is a lot. I won't lie and say it isn't. But I was on pain meds for, I think, a day and a half maybe.
Right.
Before,
So let's stop right
that
there.
wasn't
So the
that bad.
normal patient who gets a tummy tuck, because you've not done this,
Yes.
is expected to be on pain meds for at least 1 to 2 weeks.
Oh, really?
So it is the
I
word.
mean, to say pain meds, I should say like the big pain meds.
No, I'm talking about the big pain meds.
Oh, okay.
The word on the street is that you'll be in agony for at least 1 to 2 weeks from a tummy tuck. So for you to just, unbeknownst to you, be like, yeah, I was on heavy duty medications for 1 day, 2 days, 3 days.
Yeah. And then I just switched to ibuprofen.
Right. So that's uncommon.
Okay.
So you don't know that because it's expected that from a regular tummy tuck, you'll be in agony for a week. No one says surgeries are mild or you're walking apart. It's going to be uncomfortable, tight, discomfort. But there's a difference between that and, oh my God, I just broke my femur pain.
Sure.
Agony pain versus discomfort or nuisance type pain. So
I will say about the recovery that I did it and that it wasn't as bad as I thought it would be. And then I would do it again tomorrow if I were in the same place.
yeah, so I think our expectations from the body lift is that it's going to be twice that of a tummy tuck. And the answer is it is no bigger recovery than a standard garden variety tummy tuck. So you go on, you recover. And how far out are you now?
What, 6 months, I think?
6 months, yes. And let's talk about what it really matters.
Okay.
Let's talk about you're 6 months out from the surgery. 2 years ago, you were 300 pounds?
Mm-hmm.
Just think about this for a moment. 2 years ago, you were 300 pounds. 2 years later, you're sitting in front of me at 150 pounds. And you're wearing a size whatever pair of pants.
Yeah, it's amazing.
It's pretty incredible.
It
right?
is. Well, and I think the most important thing is I have more energy. I have 2 little kids who have a lot of energy and I can do a lot more with them. And, you know, I want to be around a long time for them and for my husband. So I think the health goals are just so important, and being around a long time for those that care about you is number one.
No question. So what you said to me that really resonated with me, which I love, is there are things about the way we live our life that emulate, exemplify the emotional component. So I had a woman once tell me that now that I had my surgery, I don't turn off the lights when I go to the bathroom. And that said it all. Before she was embarrassed, she'd turn off the lights, she'd go to the bathroom, so her husband wouldn't necessarily see her in her entirety. I had another woman say that I had never really let my husband really come behind me and hold my abdomen because I was embarrassed. That's one of those defining moments or words. What you said to me is, I love fashion, and now I can buy whatever the hell I want.
It's very freeing. I mean, I think I used to have to call the stores to see, do you have a plus size department? Because I wouldn't want to go in and, you know, just not be able to get anything. And that was no fun at all.
No.
Just, and the clothes are different. So being able to go anywhere and know that something can fit you is just like a totally different experience.
Yeah, and we minimize that, but it's huge. It's our humanity. Dressing is our part of our humanity. Vacationing is part of our humanity. Sitting in a chair in an airplane and having to buy one seat is a part of our humanity. We can minimize it if we want, be like, oh, it's about a sweater. No, it's about the freedom of just being a regular person and having regular person experiences. And options. Right? Yeah. And I think that's really, really says a lot. Have you had a chance to wear a bathing suit? I have. That's
fantastic. I have.
You wore a bathing suit?
I did, yes.
Holy shit, that's incredible.
It was great.
Was it nice?
Yes.
I like that.
Very much so.
I love that.
But I also, not just the bathing suit, I like being able to wear pants and tuck my shirt in. That was something I couldn't do.
Yeah, there's so many benefits to it that I think it's so powerful. And, you know, obviously the journey from 300 pounds to 150 pounds plus 2 kids is so wow that it's very dramatic. So what are your messages for individuals? Because what we're talking about is there are 3 types of people listening. One, oh, that was an interesting story. Their issue right now is they have a turkey neck from age. And this is just an interesting story. There are individuals for whom they've already lost the weight and they resonate with this story because they have the loose skin and now they're listening in that.
Sure.
And then the third is there are individuals listening and they're 100 pounds overweight or 70 pounds overweight or 48 pounds overweight. And they're at the beginning of this journey. So we have people at the start line, the middle line, and people at the end.
And I think I came on here to really talk to that, mostly to that third group. that needs to lose weight and, may feel shame or not know what to do or feel like, are these medications something I could consider? And I wanted to just come on here and say, like, you should, if that's where you're at, like you should, because I guess it was so hard all throughout my life when, like you said earlier, the misconception is that, well, you don't have self-control. This is a willpower problem. And in every other area of my life, I had great willpower and I was a very determined person and I was a very hardworking person. And I think there's this perception that overweight people are just lazy. They're just not trying hard enough. But I'm not a lazy person.
Yeah.
I'm in any area of my life. So I think that, some people may be feeling the same and it's not really your fault and you're not lazy. And there are medications that can really help you, that they can help your blood sugar and your hormones, and it's not all your fault and you can get help.
Yeah, and I think it's an eye-opening experience for me as well as being even a clinician. I never really pass judgment, as I said to you. I don't care how you got there and I don't care how you get down. I care that you do it and I can help you get to the other side. But I think that as you describe it and as the knowledge comes out and you think about obesity the way you think about gambling, you think about obesity the way you consider other things that are impulsive, intrusive, and mental, as opposed to just, I like food. Because the thing is, everyone likes food.
Sure.
And so
at least most people.
Yeah, so people don't necessarily have that empathy in that regard because you're like, well, shit, if it was up to me, I would eat 5 more slices of pizza.
Yeah.
But I think that for those individuals like yourself who have demonstrated excellence in every category, it's kind of like, I have a mild degree of dyslexia, okay? And I remember, I was like, I'm phenomenal at this, I'm phenomenal at that, I'm phenomenal at that. Like, clearly, and then like, horrible. Like, how's that possible? It wasn't because of a lack of effort or trying or whatever. It's just not registering. And so therefore, it was clear from the landscape that this one's an outlier.
Sure.
Right? And I think that your type of story is exemplary of that, is that, hey, I had all this other shit I was doing the diet, I was doing the exercise, and I just couldn't get over this hump because you can't just get over the
your body wouldn't
diabetic hump because of will or wish. You need medication. So I'm actually very excited for the horizon of these medications. I think there's going to be a little time to shimmy this out a little bit.
Sure.
I think it's kind of like we were just talking about another one of those shows. It's like these drugs are in the category of Prozac, Propecia, the like Cialis and Viagra, right? And now this class of drugs, they're game changer drugs.
Yes.
They're affecting billions, not millions of people. And so we're gonna see a huge 2 to 3 or 4 years where this is gonna figure itself out.
Sure, and it's been around a lot longer than people actually think too. I think there's been a lot of press around it, so more people hear about it, but it's not totally a new concept either. One thing I think a lot of people ask is, will you have to be on it for life? I think that's a concern that a lot of people have. And the answer is like, probably yes.
Depending on which category you're in.
Perhaps.
I think that weight loss, I think the science of weight loss is, I don't think we're all the same.
That's true.
I don't think everyone that's overweight is overweight for the same reasons. Some people are in your category. I would think that based on the description you gave me, you have diabetes. I'm making it up. And as a diabetic, you'll need diabetic medication forever. If you have, you understand, that's my condition. I think there are other people that are stuck.
And just need something to get
They're
past it.
stuck. They don't know. They're so far back that they can't see any finish line to get the energy or the hope or the inertia. You're doing all that and we're not getting past it. Some people are not even going to get off there.
I know that there are some people where that's the case and some people can successfully get off it, but the majorities of the studies actually do show that the majority of people will gain it back.
But that's the thing, is the third category. And right now, I would say that 80% of the people using it are using it to lose 20 to 30 pounds. And while that's fine, that's not your category.
No.
And those are individuals that I don't see them staying on a drug for their whole life because of the 20, 30 pounds, because those are people that they didn't do what you did. Mm-hmm. They didn't plateau on the things that they could have done. and then said, now
That's fair.
I got to pull out the guns.
Sure.
So yes, if you are in a morbidly obese category, you absolutely should use it, and you absolutely will likely need to be on it forever. There is, of the billions of people using it currently in my office, 90% of them are regular people who weren't morbidly obese. They're just, I'd love to lose some weight. And those individuals have to figure out what to do with that in that category.
And you have to lose it in a healthy way too.
Sure.
Which a lot of people don't.
Yeah.
And that
again,
is something, and I tell
yeah,
people.
there's no question about it. I'm not going to pass judgment, but I think that in your instance, your category, I think it's a revolutionary drug.
Yes.
In terms of its ability to treat a serious problem that we're unable to really get over.
I feel incredibly grateful that it was developed within my lifetime.
Yeah.
And just wish it had been developed sooner.
Yeah,
It could really change people's lives.
Good for you. You did your part. You participated. You went through the process. You stayed to it. You finished. You did everything there was to do it. And you and only you will now the recipient of that benefit. You get to dress the way you want. You get to have the energy to play with your kids. You. So you're only 40. So while it would have been nice sooner, you still have more than half your life to enjoy this new form. So thank you so much for coming on.
Thank you.
Talking about private things are always difficult, but I know for a fact anyone listening will be grateful that you participated. And I'm impressed at your knowledge level. That's great. Most people don't have a clue about what they're doing, and now you've done your homework. So we're going to see you back at a year. I want to see you in tip-top shape and working out. As always, it's yet another phenomenal episode of Plastic Surgery Uncensored. My two parting requests are the same as every episode. Number one is if you like the show, it's entertaining or educational or informative, will you go write something nice? Go and write something nice. We need it. We need your reviews because they bolster our program, bring it up to the surface, and more importantly, it gives everyone behind the scenes a feeling that, hey, you know what? We should come on a Sunday. And you know what? We should spend some time and do this because people appreciate it. The second is share the episodes, share all of our episodes, share our show with people you love. Because the truth of the matter is that you won't know until it's too late that they went ahead and had something done. And you're like, oh my God, why didn't you tell me? It's too late. Not everyone's going to tell you. So you want them to have access to this information well before it's too late. So share with the people you love. At any rate, that wraps up yet another episode. I'm grateful to you and for you to being on our show. And until next week, I'm your host, Dr. Rady Rahban, signing off on Plastic Surgery Uncensored.